to order. The Committee on Health and Human Services. Today's date is March 2nd, 2022. And before us, we have one bill today, Senate File 3472, brought to us by Senator Dahms. And Senator Dahms, I will move Senate File 3472 to be before us. If you would like to introduce your bill and tell us about it.
Well, thank you, Mr. Chair and members. Today, as Mr. Chair stated, we have Senate File 3472, and I'm bringing that in front of the Health and Human Services Committee. This bill is technically shown as Minnesota Premium Security Plan Extension Bill. It's actually better known as the reinsurance bill. And if you remember on the floor last year, we did pass a bill that would require the Department of Commerce to apply for another 5-year waiver with CMS, and that would be done by the 31st of December. The Commerce Department did do that. That was in on time, and they got a letter back stating that the application was incomplete, and some of the parts that were incomplete is last year when we authorized them to do the apply for the waiver, we felt that that would be an indication that we planned on continuing with the reinsurance program. They do need something official that states that we are going to actually do something legislatively in this session to ask for that waiver to be extended. Also, there has to be some other things that need to be done, and so the Commerce Department and the governor is kind of asked to have this process completed by the 1st of April. And so we've kind of are fast tracking this bill. And the reason for that is because we've got to go through Health and Human Service today. Next week we'll go to Finance, where there will be a lot of brushing up and things done in Finance, and then it will go to the floor possibly the following Monday so that it can be sent to the House. And obviously, I'm sure there'll be a conference committee so that we can do that. But just a reminder a little bit about what reinsurance does is reinsurance, the first 4 years of reinsurance, we had a program to where at $50,000 of claims, the reinsurance would blink on, and the insurance companies would pay 20%, and the reinsurance would pay 80% of the claims up to $250,000. At $250,000, it would blink off. Last year, right at the end of the final negotiations, about $62 million got taken out of the account. So in the bill, it authorizes the MSHA, the people that manage this, it authorizes them to change some of those combinations in order to make sure that it fits with the money available. And so last year that was changed from the blink on was 50, the blink off was 250, but the percentage of a payment blinked down from 80 to 60% by reinsurance. This bill brings it back to the 80% reinsurance, 20% insurance company, and then at 250, it blinks off and the insurance companies pay the balance. The waiver is for 5 years. And I think if Dennis, Mr. Albright would be willing to, maybe we could go through the fiscal note that we have, and then I'll open it up for questions, and we'll have testifiers. And Mr. Chair, if you would like, we could do the testifiers and then maybe open it up for questions, or go for however you want to do it. You want to do the questions as we go, whatever works for you is fine with me.
Okay, thank you, Senator Dahms. And yes, we will take and go to Mr. Albrecht first for the fiscal note, and then we'll take our testifiers, and then we can move into questions and comments. So with that, Mr. Albrecht, if you'd like to go through the fiscal note for us.
Mr. Chair, I do not have my computer with me. There are a couple of things I could do about that. One is nothing. Two is I could use Katie's computer, or I could go sit with Senator Dahms. Do you have a preference?
I do not have a preference. Whatever works best for you.
Is the camera on? I don't have to unmute, I don't think. Okay.
Mr. Chair,
Senator Dames.
Mr. Albright, would it work better for you? I've got a copy of the.
No, I
Okay,
think we're,
okay,
sorry,
go ahead.
Mr. Chair and Senator Dames, I think we're good. I don't need to unmute myself, right, Bailey?
Oh, you're good.
Why won't that go away? Thank you. Mr. Chair and members, so this is a long fiscal note. I will try and get you through it as painlessly as possible. There are 4 agencies: the Department of Commerce, the Department of Human Services, MNSURE, and MMB. The role of MMB is to make a transfer, so probably the easiest thing to do is to just look at that number, the $1.087 billion. That's the net total of everything in this bill that goes into the premium security plan account. So you can see the amounts there for each of those agencies and the funds that they're in. But it's really helpful, it'll be more helpful to go to the individual fiscal notes for the individual agencies to talk about the whole effect of the proposal. And the first one is begins on page 5. This is the Commerce Department's fiscal note. And for Commerce, they indicate the general fund appropriation of $106,000 or $108,000 and $216,000 in the second year for administrative funding. And then the amount there that is shown for the special revenue fund are the reinsurance amounts of $167 million and $196.6 million. And to get to those amounts, if I'm not mistaken, you can look at the table in the middle of page 8. And I would direct you first to the last column there, the fiscal year 2028 column, the very last number, the 1.087 billion. That is the same number that's on the front page for the transfer into the premium security account. The things that are going on in this proposal that get to that amount are all shown on this table. The first one being that at the end of fiscal year 2023, there is a $79.3 million balance in the account that will carry forward and can be used and is going to be used to pay for part of the cost of the renewed waiver, or the new waiver, I should say. Another factor is the second line there, the federal pass-through payments that you can see beginning in fiscal year 2024 are assumed to be $77.577 million. That is an amount from before there were changes made to the funding formula in the ARPA Act that had the effect of increasing funding for reinsurance. So this is sort of an assumed number going forward. There's a little bit of interest income, and then there's the total amount of resources, which you can see the fund starts to go negative in fiscal year 2025. That's a sign that the balance forward plus the federal resources coming in are no longer sufficient to continue funding the program. The next line is the Minnesota Comprehensive, the Health Association, otherwise known as MCHA. That is their administrative funding to administer the program. And then the next line with numbers in it are the actual reinsurance payments, starting in fiscal year 2024 at $244 million, and then continuing to grow, and by fiscal year 2028, becoming $384 million. On the next page, on page 10, is the fiscal note for the Department of Human Services. And these amounts are the result of the interaction between the funding formula for the Minnesota Care, the basic health plan, and insurance premiums. So the state for Minnesota Care receives 95% of the amount a person would have received had they bought their insurance through MNSURE or the marketplace to run Minnesota Care, which is our basic health plan under the Affordable Care Act. When premiums go down, the amount of money available for Minnesota Care from the federal government goes down. And so these amounts represent dollar for dollar exchange of a reduced federal funding and increased funding from the Healthcare Access Fund, which is the source of funding for Minnesota Care. And the amounts are $42.7 million in 2023, and $90.8 million in 2024, and $96.4 million in 2025. I talked in the beginning about the fiscal note for MMB, which is on page 13. And then the last agency is MNSURE, and the amounts for MNSURE are $2.1 million in 2023, $4.3 million in 2024, and $4.6 million in 2025. MNSURE is also funded based on insurance premiums. They are funded with a 3.5% withhold on the total amount of insurance.
Mr. Chair, could you tell us what page you're on, Dennis?
Mr. Chair and Senator Dahms, I am on page 16.
Thank you.
So MNSURE is funded with a 3.5% withhold on insurance premiums. When insurance premiums go down because of reinsurance, that reduces MNSURE's revenue for their operations. And this fiscal note assumes that there would be a general fund appropriation for MNSURE's ongoing operations costs during the duration of that the reinsurance plan is in effect. That's a short explanation, I think, Mr. Chair, of a 20-page fiscal note. If there are any questions, I'd be happy to answer them.
Well, thank you very much, Mr. Albrecht. Members, any questions? Senator Klein.
Thank you. Thank you for the explanation. Thank you, Mr. Chair, and thank you for the explanation, Mr. Albrecht, of the fiscal note. And this may seem like a rudimentary question, but I'm not an accountant, and I appreciate the work with numbers that you've done here. You know, the total expenditures required through 2028 are the $1.08 billion that you described, and yet we transfer that full amount of funding in fiscal year 23, presumably, you know, to stack the fund for the next 5 years. Does it have to be structured like that? Could you do it on a year-by-year basis and pay it going forward in that way?
Mr. Albrecht? Or Senator Dahms, I guess.
I could.
Mr.
Senator
Chair and Senator Klein, I think I would defer to Senator Dahms on that.
Okay, Senator Dahms.
Thank you, Mr. Chair and Senator Klein. We have the option. You can pay it as you go, or we can pay the 5 years up front. So if we pay the 5 years up front, that money then would be put in the Minnesota Premium Security Plan, and that money would draw interest. If you pay it as you go, you would, so let's say we chose to pay it for 2 years, then we would show 2 years coming out of the budget and being committed to 2 years on the premium, to go into the premium security account. That may or may not go in the first year. You could put 1 year in and then do the appropriation in the second year and put the second year in that time period. Does that answer your question?
Senator Klein?
It does, Mr. Chair, and Senator Dahms, was there a reason you preferentially chose to fully stack it at the start of the 5 years? Or?
What we're doing is we are going to decide exactly how this process is going to go, and in finance, we will have a amendment in finance to amend the current session, or Senate File 3472 will be amended in finance in order to decide what we're going to do, how many years we're going to pay, and there's some other things that will be also into that amendment. So today I ask to present the worst case scenario of total dollars being spent, because I don't want to get onto the floor and have people say, how come you're changing the numbers? So I figured we would use the five-year fiscal note, because that is the one that shows the full 5 years. And if we do less than that, that amount will be reduced accordingly. Now, it's not going to be dollar for dollar for a 5-year program. It's not going to be just 20%, because there will be some other adjustments. It'll probably be a little higher going year by year, but not much. But so that's why that's why I've asked to do it that way today. But thank you for the question.
Senator Klein, you're good? Okay. Any other?
Mr. Chair,
okay, Mr. Albright.
It might help just to be clear why that big number is there where it is. And the reason is because the bill actually has the transfer happening in fiscal year 2023. So that's why the Department of MMB put it there.
Okay, thank you. Senator Nelson.
Oh, thank you, Mr. Chair. I just have a couple questions. If you've answered them already, you can tell me offline or be very brief. I don't want to waste the time of the committee here, but I do want to just know, Senator Dahms, about the 1332 waiver, the status of that. I understand our application has been denied. I just want to know, once we pass this legislation, kind of give me some assurance on getting that 1332 waiver. And the corollary question has to do with, as we put state dollars into this reinsurance plan to help reduce the cost of insurance for Minnesotans, particularly in the small group market where it's increased so dramatically. And we plug in state funding to hold down the cost of that insurance. How does that impact their state subsidies to help pay for that insurance? In other words, don't want to put in state dollars so that the feds give less premium assistance to Minnesotans. And maybe the 1332 waiver is part of that answer.
Senator
Well, thank you,
Dahms.
Mr. Chair, and I think there's kind of several parts of that question. So let's start with the first one, that being the 1332 waiver and where that's at as we speak. The Department of Commerce did submit the 1332 waiver according to the legislation we passed last year, and they did get that in on a timely fashion, and they got notice that the 1332 waiver was incomplete. And so they listed the things that need to be done. And one of the things that, and some of those things will be interactions at the Department of Commerce, part of its interaction at the legislative level. And one of those interactions at the legislative level is they did not, we felt that with us passing the legislation stating that we were asking, or we were having the Department of Commerce put in a request for another 5-year waiver would be enough to show we were going to do it. The CMS says that's not enough. They want actual legislation in this year showing that we are going to do reinsurance. And then also there were some other things that the Department of Commerce has to do. And then that will be ready to be, they'll have to send those parts in, and then it'll be relooked at. The Department of Commerce and the governor have requested that we have this bill done by April 1st, so that they can get this done in a timely fashion, so that the insurance companies know early what the actual reinsurance is going to look like, so that they can do their planning, because of the time they have to release their rates, I believe now is in July. And so they need time to do that. So that's why we're kind of fast tracking this bill. Now, when we talk about subsidies, we have the 1332 waiver. There's part of that waiver, and if you look in the fiscal note, it shows that we're going to get $77 million a year back for the first part of that waiver. Now, that number is used all the way through the 5 years. Very likely that number will adjust up or down, more than likely probably up, because of the costs are shown to go up. So we get that back. On the second part of the waiver, even though this 1332 is a hold harmless waiver, we found out in the previous waiver that truly that part of it was not hold harmless. And that part was the second piece, which did not pay some of the interactions with the health benefits, the basic health plans. Minnesota and New York are the only two states that have basic health plans. And so with those basic health plans, we lose some funding. And CMS said that that was approved to be paid. When it went to the Treasury Department, they said no, they didn't think that was supposed to be paid. There were some dollars collected. There was some different things done with that, and there were some dollars collected on that, but we never were made whole on that. Now, in the governor's plan that he put out in his budget this year, he's using the assumption that this will be taken care of prior to reinsurance going in next year. So we don't know what how that's going to work. As far as your answer about subsidies, we don't know how that's going to work. Now, you also remember in some of the ARPA money, there was some money there so that people that paid more than 8% of their income in health insurance premiums could get a subsidy. That is now, that sunsets, that's done at the end of 2022 unless it's renewed, and that has been not renewed yet and doesn't look like that's probably going to happen. So that subsidy will go away. So that's why it's very important to get this reinsurance moved, because if you take a look at the Department of Commerce, I think they say they figure the premiums would go up about 25%. The health industry says about 20%. And if you look at CMS, they say anywhere from 18 to 36%. And so it would make a major impact. I hope I answered your question.
Senator Nelson.
Thank you, Mr. Chair. You answered a great deal of it. Thank you, Senator Dahms. Just that my final little follow-up question, what is that assumption that you mentioned that Governor Walz is assuming as he put out his budget? Can you give a little bit of information about what is the assumption?
Mr. Chair?
Senator Dahms.
Senator Nelson, the assumption is that they're working on trying to get this changed, and several of our Minnesota federal politicians are working on this to try to get it changed so New York and Minnesota would not be, that we would be held harmless even though we have a basic health plan. And that would give us that second piece of the 1332 waiver, which now is in question.
Thank you, Mr. Chair.
Okay. Senator Nelson.
Thank you, Mr. Chair and Senator Dahms. And then the bigger question is, why is Minnesota island once again? And that's a bigger question for another day.
Okay.
So we'll set that aside.
And we're still kind of on the fiscal note part of this presentation. And so, Senator Wickland.
Thank you. Thank you, Mr. Chair. I had a question about the MNSURE part of the fiscal note and how it relates to your bill, Senator Dahms. So I don't know if it's a question for Mr. Albrecht or more for yourself, Senator Dahms. But does your bill cover the cost or the loss that is seen in the fiscal note for MNSURE's budget due to the decreased amount of funding that they received, that they will receive over time? You know, that adds up to be, you know, I think over the course of those years, over $20 million. And I'm just wondering, is that included in your bill in terms of appropriating money for MNSURE to be able to cover the costs they have that they use that money for.
Senator Dames.
Oh, thank you, Mr. Chair and Senator Wicklet. A very good question. The fiscal note does have that baked into the total cost. And so I think the first couple of years, it's a little over 8 million. Over the time period, it run and averages about it was about 4.2 million. So it's going to be around that 20 million. The current bill does not include that. However, we'll be doing an amendment, and we'll see where that ends up within that amendment. But we're very, very well aware of that, and certainly understand that interaction it has with the Healthcare Access Fund and the reduction in premium due to the reinsurance, which allows for MNSURE to receive less money. So we'll deal with that when we get the finance. But it's a very good question, and we're very well aware of it. So thank you.
Okay, thank you. Senator Benson.
Thank you, Mr. Chair. And Senator Dames, I was looking at the MNSURE budget and the governor's budget request. And let me see if I can find the year. For 2020 and 2021, they were given appropriations for full-time equivalent of 182 employees. And it looks like their actual employees were 166. So I think before you agree to give them money in this bill, we should figure out what happened with the gap in FTEs, because they might in fact be building up a reserve and you wouldn't have to fully fund them.
Senator Dames.
Mr. Chair.
Excuse me, Senator Dames.
Senator Benson, you said that they had approval for how many EFTs?
It looks like from the governor's budget base, 182 FTEs, but their actual was, 167.
Thank you.
Senator Dames, and then for reference, we do have, if it is something you want to dig into with MNSURE, we do have them on this online too, so
yes,
you can handle that however you'd like.
Thank you. And Mr. Chair, just
Senator Benson.
if I could, a reminder for the people who've been following MNSURE since the beginning, their premium withhold was supposed to be 2%. It's still at 3.5%. And so let's be really cautious about adding to their funding. And further note, when reinsurance wasn't scheduled for renewal, MNSURE didn't take a reduction, even though their premium income was coming up. So they're kind of playing both sides. With all due respect to Mr. Clark and his staff, they didn't account for the increase in premiums when MNSURE, or when the premium security account wasn't in the forecast, and now they're accounting for it. And so I think, Senator Dames, before you give them any money in this bill, we should have a thorough walkthrough.
Thank you.
Okay, thank you. Senator Abler.
Yeah, just briefly, I just want to echo Senator Benson's point. We were here for that, and 2%, you're never going to need the 3.5. It's going to be fine. It's going to be such a workout so smoothly. You'll never need the 3.5. I remember that. So also, I just want to, my one comment is we really have to do this, and I think Senator Dames and the crew have got a good package together, so I hope this can get done and timely. So thank you.
Thank you, Senator Abler. And I think, Senator Dames, are you ready for your testifiers?
Yes.
Call them down. Okay. First up, we've got Mr. Graves with the Minnesota Chamber. If you would like to join us, and then following Mr. Graves will be Mr. Reynolds. Welcome to our committee, and you know the routine. Just please identify yourself and proceed with your testimony.
Thank you, Mr. Chair and members. My name is Bentley Graves. I'm with the Minnesota Chamber of Commerce. We represent over 6,000 employers and over 500,000 employees across the state, in all corners of the state, all sizes of business, and every industry in the state. We work on healthcare issues, I think, as you know, is because it's an incredibly important benefit for employers to offer employees, both to keep their employees healthy and productive at work, but also as a very important tool to attract and retain talent in this very competitive marketplace. But as you know, healthcare costs are rising rapidly, and the ability to continue offering coverage to employees is challenged every year. Now, many have kind of wondered what interest the business community has in a stability mechanism for the individual market, given that most employers purchase their coverage for themselves and their employees in the group market. But the reality is that the individual market, beyond being just an important resource for self-employed individuals and entrepreneurs, is increasingly becoming an important outlet for particularly small and mid-sized employers as well. We did a survey of our members just this summer, and already just in the last couple of years where kind of new defined contribution arrangements have been available under federal rules that allow employers to help their employees buy their own individual insurance. Already just in the last 2 years that's been available, already 6% of our members have said that they've turned to those coverage options to find coverage for themselves and their employees. Similarly, 1 in 10 of our members who currently offer coverage for their employees reported that if healthcare costs continue to rise at their current rate, they would be looking to transition, their coverage to these defined contribution arrangements. And also, for those members of ours that don't currently offer coverage, about 30% of them said that they were looking at these options as a way to provide coverage for their employees. So these kinds of emerging trends we think provide all the more reason to maintain a healthy and stable individual market here in Minnesota. And as Senator Dahms had noted, reinsurance has done just that. It's brought stability to the market, it's lowered rates, and our hope is that we can see this program continue forward. Senator Dahms noted that rates are anywhere from 20 to more than 30% lower in the individual market because of reinsurance, depending on the metal level of the product that you choose. And we also know that were reinsurance not in place next year, rates would go up dramatically. So I want to thank Senator Dahms for bringing this forward and for his continued work on this over the years. We want to lend our strong support to this effort, and I'm happy to answer any questions you may have. Thank you, Mr. Chair.
Thank you. Oh, Senator Nelson?
I can wait until after the testifiers.
Okay, thank you. Welcome, Mr. Reynolds, and please identify yourself and then proceed with your testimony.
Thank you, Mr. Chair and members. I'm John Reynolds, the State Director for the National Federation of Independent Business in Minnesota. We're the state's largest small business organization with over 10,000 members in every corner of the state. 75% of our members have fewer than 10 employees.
Kind of move up to the mic a little bit more, and I think, well, everybody will hear a little bit better.
Mr. Graves must have had a
Use the
different
big
perch.
boy voice.
I apologize. I'll stop whispering. First, thank you to Chair Dahms for carrying Senate File 3472. We're pleased to see the other body take action on this bill yesterday, and appreciate the bipartisan support for this highly successful program. The individual market is important to Minnesota's small business community and is the source of coverage for many small employers, their employees, and self-employed entrepreneurs. Instability and rising premiums in the individual market are bad for small businesses, as we witnessed from 2014 through 2017. Fortunately, beginning in 2018, the reinsurance program reversed the years-long trend of double-digit premium increases for individual market enrollees. It also halted the half-decade-long drop in the number of people insured through the market. According to a September 2021 review of Minnesota's 2020 reinsurance program by the Federal Centers for Medicaid and Medicare Services, reinsurance reduced the lowest cost bronze plan by 22%, the lowest cost silver plan by 34%, the second lowest cost silver plan by 36%, and the lowest cost gold plan by 31%. Reinsurance helps offset a relatively large share of high-cost claims in the individual market. It does this through state and federal funding provided to the Minnesota Comprehensive Health Association, or MNSURE. When a person has a serious medical event that qualifies for reinsurance, the medical provider bills the insurance company, the insurer pays the claim, then submits it to MNSURE. MNSURE reviews the claim and reimburses it if it qualifies, or denies it if it doesn't. In other words, reinsurance helps pay for health care for very sick people. Almost 2/3, 62% of eligible enrollees had 2 or more serious health conditions. And according to the 2020 year-end reinsurance report, the top 5 conditions for which reinsurance helped cover the cost of care were diabetes, asthma, COPD, rheumatoid arthritis, metastatic cancer, and heart arrhythmia. In this sense, reinsurance serves a similar purpose to the program run by MNSURE from 1976 through 2014, which enjoyed broad bipartisan support through the decades. With regard to future funding of the program, it's important to note small business and their employees in the individual and small group markets already pay multiple taxes on health insurance sold to the state. This includes a 1% gross premiums tax that adds more than $100 million to the cost of health insurance, and as Mr. Albrecht noted earlier, a 3.5% MNSURE premium tax that adds over $20 million to certain individual policies. Because the combined enrollment in the small group and individual markets has declined by over 40% in the last 15 years, additional fixed assessments would have an outsized impact on these plans' affordability. As CMS's report also noted, Minnesota's reinsurance program makes such an impact in part because of the reliance on broad funding sources from outside of the individual market. Lastly, we appreciate that reinsurance continues to be transparent and accountable. It is governed by a longstanding state board, MNSURE, and reviewed quarterly at the state level and annually at the federal level. Robust program administration, auditing, and reporting requirements are outlined in Chapter 62E. Again, thank you, Mr. Chair. Thank you, Senator Dahms, for carrying this legislation. We urge the committee to support.
Thank you.
Thank you.
Yep, thank you.
Next up, Mr. Andreessen.
Good to see you.
Welcome to our committee. Please identify yourself for the record and proceed with your testimony.
Thank you, Mr. Chair, members of the committee. My name is Dan Andreessen with the Minnesota Council of Health Plans, the trade association for Minnesota's nonprofit health insurers. This includes Blue Cross Blue Shield of Minnesota, Health Partners, Medica, Sanford Health Plan, and UCare. Thank you for the opportunity to testify today in support of extending the reinsurance program, which was created to stabilize the market and lower premiums for people buying insurance on their own. It does so by paying a portion of high-cost medical claims, costs that otherwise must be built into premiums. Under Minnesota's reinsurance program in place today and as proposed to be extended, high-cost medical bills paid by health plans are partially reimbursed by reinsurance funds, which are audited by the Minnesota Comprehensive Health Association. Doing so effectively takes a portion of these costs out of the premium equation. As Mr. Reynolds mentioned, the association ensures program integrity by contracting with an independent actuarial firm and makes public on their website the quarterly and annual reports examining the program's operations. In your packet is the most recent 2021 fourth quarter report, this one here, which documents where funds are allocated by health plan, geographic area, metal level, and health condition. The reinsurance program has performed as advertised. The individual market has been stable and has successfully lowered premiums by an average of 20% compared to what premiums would be without a program in place. The Centers for Medicare and Medicaid Services concluded in a recent study that an additional 89,000 Minnesotans had coverage in 2020 thanks to the reinsurance program. Conversely, if reinsurance is not extended, these costs will be built back into premiums, causing an additional increase of 25%. Minnesota's Department of Commerce in their 1332 waiver application projected this will result in 15,000 Minnesotans losing coverage in 2023. Reinsurance has been proven to stabilize the market and has resulted in tens of thousands of Minnesotans getting coverage. The program has been so successful that 14 other states have enacted similar programs over the past several years, and Congresswoman Angie Craig is a leader in Congress trying to create a federal program. The Council thanks Chair Dahms for his leadership in continuing this program and urges your support. Thank you.
Thank you. Next up, we've got Mr. Stein. Good afternoon. Welcome to our committee, and please identify yourself for the record, and you can continue with your testimony too. Thank you.
Mr. Chair, committee members, good afternoon. My name is Bob Stein, and I'm an independent insurance agent serving individuals and small employer customers in the Twin Cities and the greater Minnesota. I'm here today representing the Agents Coalition, which includes 4 professional agent associations in Minnesota, including the Minnesota Association of Health Underwriters, National Association of Insurance and Financial Advisors, the Professional Insurance Agents, and Minnesota Independent Insurance Agents and Brokers. Collectively, we represent over 54,000 licensed insurance agents throughout Minnesota. Our agents represent 2.25 million Minnesotans covered by the private market, and we are closely work with group and individual market consumers on a daily basis. We strongly support Senate File 3472 to extend the reinsurance program, and we thank Senator Dahms for his authorship of the bill and Governor Walz for including it in his supplemental budget. The individual marketplace is not only where individuals and their families get coverage when they do not have coverage by employer-sponsored coverage, it is where entrepreneurs get their coverage when they start a new business, and is also relied upon by individuals between jobs and early retirees. When the ACA moved 27,000 sick people from the MCHA program to the individual market, the premium impact drove huge price increases, and carriers were leaving the individual market, and our clients and your constituents were getting headline-making double-digit premium increases. Without this program, it is uncertain if any carriers would have chosen to continue offering coverage in this segment. We do, however, have significant concerns about the reinstituting the MCHA assessment. The fully insured market has been shrinking for years, and now, according to Minnesota Department of Health, makes up just 16.3% of the market. So putting such a tax on such a small market segment offsets much of the benefit of reinsurance, since the group paying is not much larger than the individual market itself. The largest employers will not contribute any to the program, which compensates the individual market for the adverse selection it bears for the entire market. We encourage you to consider a broader funding source that reflects the benefit of this program to all Minnesotans. We supported the creation of this plan, and we are here to report back to you today that the premium security plan that you passed in 2017 is working, it needs to be continued, and made permanent. When the program was first implemented, according to Minnesota Department of Commerce, this plan resulted in premiums being 20% lower in 2018 than without the plan. All of the benefit of this program goes directly to consumers, as shown through the rate filings of the carriers. In fact, no funding goes to the bottom line of the insurance carrier, since they can only make claims for actual medical losses and are then reimbursed by the MCHA, which administers the plan. They cannot receive reimbursement for their overhead and administrative costs. Consumers, your constituents, benefit directly through lower premiums. Please support this bill and help keep stability in this vital program for individuals and families.
Thank you.
Thank you.
Okay, members, that concludes our list of testifiers.
Mr.
We'll open
Chair.
it. Oh, Senator Dahms.
If Peter Brickwood is here, I think he would like to testify. He did testify at the last stop, so if he's here, we should give him that opportunity.
Senator Dahms, he is here. Mr. Brickwood. Welcome. We weren't trying to cut you short. We just didn't have you on the list. We saw you here, but so welcome to our committee.
Mr. Chair, Peter Brickwood from the Department of Commerce, Assistant Commissioner, and I did not sign up to testify, although I appreciate Senator Dahms giving me the opportunity to memorialize a welcome to the world to my nephew Lionel, who was born yesterday morning, for all time. This will go to the state repository. Happy to answer questions, but I did not need to testify proactively, Mr. Chair.
Okay, thank you. All righty, members, we'll open it up for questions, comments for Senator Dahms or the testifiers. Senator Abler?
Mr. Brickwood, maybe you can come back. So we tried to weasel out of that.
Okay, we'll get to
So thank you, Mr. Chair and Mr. Brickwood. Nice to see you, the committee. The thing about this, I think the other body has a kind of a self-insured version of reinsurance, which kind of defeats the whole purpose. I'm curious what the governor thinks about that. I just give you a hint. I think the version we have is better here, but you can say what you like about it. Thanks.
Mr. Brickwood.
Mr. Chair, Senator Abler, I wouldn't want to speak for the other body, but the governor's budget does have an assessment mechanism that would cover the state's share of the costs of the reinsurance program going forward. That concept, which is not a novel one, is employed by the states of Maryland and our neighbors in North Dakota to finance their reinsurance programs. It's also modeled after the way that we financed MNSURE when it was in its previous incarnation as the state's high-risk pool prior to it being converted to being the facilitator of the reinsurance program.
Mr. Chair.
Senator Abler.
Yeah, MNSURE was a good bill for a good project for a different time when we actually had a lot of people fully insured. I'm not sure if we want to race to keep up with North Dakota, Mr. Chair, so thank you.
Mr. Chairman.
Mr. Brickwood.
Mr. Chairman, Senator Abler, generally speaking, I would agree with you there. But I just wanted to point out that it's not an idea that is new or not currently employed in other places that have reinsurance programs that resemble ours. As they followed us, into reestablishing a reinsurance program at a state-based level.
Thank you, and for you two, we'll continue this conversation in the back because that happens to be my home state, so. So, with
Apologies,
that,
Mr. Chair. It's a fine state to raise your kids.
with
Thank
that,
you.
we're going to move on to Senator Nelson.
I'll hold my question.
Okay, Senator Klein.
Well, thank you, Mr. Chair, and thank you, Senator Dahms, for presenting the bill. So, yeah, a couple of thoughts. We initially did reinsurance when a few of us, including me, first landed in the legislature, and it was quite clearly a response to a crisis in the individual market. It was clearly presented as something that was a temporary exigency in view of a longer-term plan. It was a transition to something that would be more efficient and more consistent with the wishes of Minnesotans. As it's currently structured, I concede it has been effective in stabilizing the individual market. I still think Minnesotans and I myself have significant concerns about subsidizing our private plans in this way and buying down their risk as opposed to actually paying directly for health care or paying directly to people who experience health incidents. And I think Minnesotans would broadly support that. The way the bill is presented for us to vote on today indicates a serious of purposeness about extending it for an additional 5 years, as we are fully funding it in the first year, 2023, for the full years. So I anticipate that the way it's being described means that we're serious about not considering alternatives, and I think we should be. We talk frequently about sunsets in this committee, and this is a bill ripe for a sunset. And with that, Mr. Chair, I'd like to offer the A2 amendment.
Senator Klein offers the A2 amendment, and that's in all of our packets. Let me find it. I got it. Senator Klein, would you like to explain your amendment?
It's a simple amendment, sir, and Mr. Chair, it simply decreases the duration of this reinsurance plan from 5 years down to 2 years and puts our feet to the fire in terms of finding more practical and reasonable solutions to the individual market in the state of Minnesota.
Senator Dahms?
Well, thank you, Mr. Chair and Senator Klein. First of all, you're looking at changing this from down to a 3-year or 2-year. The 1332 waiver is a 5-year waiver. And so it kind of, we're going to go through all the work. We did this in 2017 for 2018. We applied for a 2-year waiver. We ended up getting a 5-year waiver. So I don't see the purpose of going through the work and stuff to switch this from a request for a 5-year waiver to a request a 2-year waiver when we're going to get a 5-year anyhow. So I would not support this amendment, Mr. Chair.
Okay, thank you.
And if it's not only the waiver, Mr. Chair, excuse me, if it's not only the waiver that's being talked about, if it's also the funding that's being talked about for 2 years, I would not support this.
Senator Klein, I get Senator Wickland, take her first. Okay, Senator Wickland.
Oh, thank you, Mr. Chair. I just wanted to say I'm supportive of Senator Klein's amendment. I think that what he's getting at is that we have a program that is effective in perhaps in stabilizing the premiums over the time, but we don't have any other information to help us show that the program is really helping Minnesotans for the amount of money that we put into it as a state, that we're showing benefits in terms of health outcomes or lower healthcare costs for Minnesotans. I mean, we are spending significant amounts of state funding to do the reinsurance program, and I think we should be doing a lot more to examine whether this is the best use of our state funds. Or could we be implementing other ideas that would have a greater effect on more Minnesotans being able to afford their health care costs? I'll speak a little bit more about that later, but I just wanted to say I support this amendment, and I think that it's appropriate that we set ourselves a deadline that's shorter than 5 years, so that we are going to, address healthcare costs in a way that it might be more sustainable and have a better health impact for Minnesotans than just pursuing reinsurance. Thanks.
Okay, thank you. Members, any other questions concerning the A2? If not, we'll take a vote. All those in favor of the A2 amendment, please signify by saying aye.
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 Opposed?
No. No.
The motion, or the amendment is not adopted. Further comments? Senator Klein.
Well, thank you, Mr. Chair, and I didn't want to leave the committee without other potential options to address the individual market, as has been the case in previous years in this legislature, where with reinsurance, the bill has come up. Neither party advanced a significant alternative, and I have, in those circumstances, voted for the bill for that reason. But I do think there are ways to structure controlling the individual market costs that more directly accrue benefits to individual Minnesotans and to patients and to health systems, as opposed to mitigating risk for insurers. With that, Mr. Chair, I'd like to offer the A6 amendment.
Senator Klein offers the A6 amendment, which again was in our packets. Everybody should have a copy. And Senator Benson. Okay, Senator Klein, further description of your amendment.
Yeah, thank you so much, Mr. Chair, and thank you for giving me the opportunity to present this, and I'll notify the committee that I do not intend to bring it to a vote. I will withdraw it, but I would like to have the discussion today just to show that alternatives are out there and have been worked on. This is a proposal to build upon the federal advanced premium tax credits under the American Rescue Plan, which were so effective nationwide in controlling healthcare costs for Americans. Bringing down, in the federal case, the amount that an individual would pay for their premiums to 8.5% of their income. This would bring it down even further at a statewide level to 5% of income for everyone between 200% and 800% of the federal poverty level, making premiums in the state of Minnesota through advanced premium tax credits much more affordable for Minnesotans. The money that we are currently sending to Blue Cross Blue Shield and other plans would go to tax-paying Minnesotans in the form of a tax credit. This is the season for tax credits, given that we have a $9 billion surplus. The second part of this amendment actually also works to control co-pays and deductibles, something that is not addressed by the reinsurance program. Actually buys every Minnesotan's plan up in the individual market up to a higher actuarial value so that they are more able to readily access health care. We did get a revenue note on this proposal, senators, and it cost $220 million in fiscal year 2024, $234 million in 2025. So comparable with what the proposal before us costs, but in my opinion, a better and more legitimate use of state funds. And I'm open to response from the committee before I withdraw the amendment.
Thank you. Senator Draheim.
Thank you, and thank you, Senator Klein, for bringing this forward. Is there any other states that use this type of model?
Senator Klein.
There are states that have looked at cost-sharing reductions, in particular, I want to say Oregon, and so they did the second part of what I've done here, but they did not do the state-based advanced premium tax credits. No, that would be unique to us.
Senator Draheim?
Good, thank you.
Good, okay. Any other questions for Senator Klein? Senator Dahms, any comments?
Well, this would get away from reinsurance and go to a tax subsidy. And CMS has estimated that if something like this was done, we would lose about 10,000 people, or about 10,000 people in the individual market that would not seek insurance. So, I think there's a lot of good ideas, but over the years, there's been a lot of good ideas, a lot of them discussed, a lot of them researched, but at the end of the day, the thing that still works best, considering that this was brought on by the Obama Affordable Care Act, and they have not made many changes to help this individual market, that this is probably the best way to do it. But there's not going to be a vote on it, so I'll say no more.
Okay, thank you. Senator Benson.
Thank you, Mr. Chair and Senator Klein. Glad to have a new idea brought to the table. Senator Dahms addressed one of my concerns. What happens to uptake in the market? Because the bigger the pool is, the more we spread the cost. And the other gap that I'd like to see addressed, so with reinsurance as it is, it leaves the insurance companies on hold for controlling the front end and the back end. We only pick up the middle in sort of those extraordinary cases. So I'd like to see what it does for cost, not just for the premium, but cost in the system. And so I think those are things that need to be vetted as you continue to look at this. And as we compare this plan that might be implemented in other states with Minnesota, we always have to remember Minnesota Care pushes part of our individual market out, so we don't get as much uptake as a non-BHP state might. But thank you for the amendment.
Thank you. Senator Wickland.
Yeah, thank you, Mr. Chair. I just wanted to comment. I'm supportive of the amendment and the discussion about other mechanisms that we might use that would get more of the taxpayer funded portions to Minnesotans to be able to apply to their health insurance costs, and also to look for ways, to control costs so that overall, Minnesotans are seeing a greater impact than they are with reinsurance. Thank you.
Thank you. Senator Klein, hopefully we gave you a little bit of good feedback, and we're back to you.
I appreciate the wisdom of the committee, and I do appreciate the genuine feedback from the legislators, and with that, I withdraw the amendment.
Thank you, Senator Klein. Members, we're back to discussion on Senate File 3472. Any further questions, comments for the author? Okay, Senator Draheim.
I just want to thank the author for bringing this bill forward, and I would request a roll call.
Okay. Anything further? If not, Senator Abler.
I don't just hate to waste all this good time to talk about it, but I think this program has performed even better than expected, and I think not an actuary, and people said you should be an actuary because I was good at math, but I never really aspired to that. But I think the presence of this has helped actuaries who are by their nature very conservative in their estimations to feel a little more relaxed. And I don't have any documentation for it, but it seems to me, as I did some math before, that we got a little more value out of it than we put into it. And so I think there's a true value to this beyond just the face value and relaxing the concerns that actuaries may actually have to raise the rates just to be sure they can cover their losses. Back in the day, I was like Senator Klein, I had some other ideas I thought might work a little better, and I didn't win that fight about Alaska and other versions. But for now we have this, but if we don't keep this market stable, a lot of bad things are going to happen. And the last thing I think we need, given the whole Ukraine thing and this imaginary $9 billion budget surplus as oil raises well over $100 and all that, is to upset the insurance industry for people, small businesses and farmers and families that are counting on this. So we can discuss alternatives, and I think that'd be fun. But for now, I agree with Senator Dahms. This needs to go forward, and hopefully we can deal with this matter about the people who are buying the insurance, insuring themselves for reinsurance, which I think is just really a bad idea. So, but thanks, Mr. Chair. I appreciate the discussion.
Thank you. Senator Wickland.
Thank you, Mr. Chair. I just wanted to make a couple other comments about the bill, and I will not be able to support the bill going out of the committee today. I think that it has a very large cost. We see more than $1 billion over the 5 years that is in the fiscal note. And I know that Senator Dahms has explained that in the Finance Committee that more work is going to be done about how the cost will be addressed and where the funding will come from, if it'll be general fund money, or other mechanisms, but I have some serious concerns about how we're spending such a large amount of money, taxpayer money, and what we're getting for it. I hope that Senator Utke, Chair Utke, that you are considering hearing some of the bills that might address healthcare costs for Minnesotans. I hear that people buying plans on the individual market, while they're benefiting from premiums that maybe are lower than they would have been without reinsurance, they still are facing healthcare cost of premiums and out-of-pocket expenses that are just not affordable. And so I would hope that in this committee that we are also able to hear bills that will address consumer healthcare costs, because they're just too high. There have been many bills introduced. Examples include a bill I introduced that would extend opportunities for people to purchase the Minnesota Care Plan. There's a bill that Senator Murphy has introduced that limits cost sharing for prescription drugs and supplies, that people with insulin would definitely benefit from our consideration of this proposal. There is also a discussion about long-term, what sort of health plan should we be exploring in Minnesota that helps all Minnesotans be able to afford access to health care, which should be our goal. So I think that the structure of this current reinsurance plan isn't designed to help us understand how we're improving health outcomes, and I think that's a deficiency of it as well. We really need to do more work to understand how to lower healthcare costs and how to improve health outcomes. And I don't see this bill at this time going forward in a way that does that in a successful way. So I will be voting no today. Thank you.
Okay, thank you. See no further comments. Back, Senator Dahms, final comments on your bill?
Well, thank you, Mr. Chair and members. We appreciate your taking the time and the discussion we've had on the bill and on some of the amendments. And when we get into the Finance Committee, we will have an amendment there that will clean this bill up. So thank you very much for your time, and we'll leave it at that.
Okay. Thank you, Senator Dahms, and I will renew my motion for Senate File 3472 to pass and be sent to Finance. And a roll call has been requested, so Mr. Martins, if you turn on your mic and if you would take the roll call for us.
Senator Utke?
Aye.
Senator Draheim?
Aye.
Senator Wickland?
No.
Senator Abler?
Yes.
Senator Benson?
Yes.
Senator Eaton?
No.
Senator Klein?
Yes.
Senator Duran?
Yes.
Senator Nelson?
Yes.
There being 7 yeses and 2 noes, the bill does pass. Thank you, everyone. Thank you, Senator Dahms.
Thank you.
Members, that's all we had before us today. Monday, we will be bringing up the topic, informational hearing, but it will be concerning white bagging. And I'm sure you've all had numerous conversations with people about that. So Monday should be an interesting day. We'll hopefully learn more and be able to ask questions and leave a little bit smarter than we arrived. So with that, we'll stand adjourned until Monday.